Good morning, everybody. Thank you very much for coming here for the second of our panels on the coronavirus, its human, social, and political implications. I know many of you were able to watch the online session that we ran at 8 o'clock this morning, US time, 9 p.m. China time. We had 197 people attending that. And we had a very good discussion. I know some of you were able to see some of that. The purpose of our session now is to be a bit more reflective about what we see as the key issues that are emerging as a result of the coronavirus, from, broadly speaking, the perspectives of health, humanities, society and culture, and political relations. And we're going to divide up our panelists into three groups. So on my right here, we have people, broadly speaking, from the perspective of health humanities. Professor Ben Anderson is assistant professor of global health at Duke Kunshan University. Nicole Barnes is a professor of history here at Duke. She's an expert on the history of health in China. Carlos Rojas is the co-director of the Humanities Research Center at DKU and is a professor of literature and gender and arts of the moving image here at Duke. Ralph Litzinger is a cultural anthropologist here at Duke who has written many works about issues to do with labor and technology and social change in China. So we're going to start with these four. We've asked them to present just a short very short reflection about what they're thinking about the coronavirus, broadly speaking, from a health humanities point of view, and then we will have a general discussion. We can take questions from the audience. We also have some questions that we didn't get to during the online session, and then we'll move over to our second mini session, which is really featuring voices of students and projects to collect voices of students. And then finally, we'll move over to the broadly political implications and also Sino-US relations.
So good morning, everyone. We, in the last session, spent quite a good amount of time discussing the epidemiology of the outbreak. I won't spend much time on updating here. So we've really just been asked to kind of share what we're thinking in a deeper context, even maybe to prompt some discussion. We know that the virus's infection rates are waning in China, but starting to take hold in the rest of the world. And so this is something that's going to continue to be impacting the lives of people throughout the world. And in my thinking as an epidemiologist, the first thing that comes to mind is first the immediate response. What can we do now to mitigate the harm or the risk to people from the virus? But there will become a point too, as we are thinking more forwardly, what lessons are we able to learn throughout this process? And I think in my view, some of the things that stick out to me that are going to be things that are really key is this idea that we've seen a lot of comparisons to previous pandemics. We've had a previous pandemic in 2009 from influenza. There are some things that you can draw conclusions on by comparing responses to then and now, but there's also the fact that this is a different virus. It has a different profile. It has a different situation. And we also are in 2020, and our societies are slightly different than they were maybe even 10 years ago. So what I like to see in terms of discussion and kind of thinking through from the epidemiology standpoint is as we live in a world of continued interdependence, global interdependence, this need to learn lessons to be able to respond effectively in the future from a public health perspective, but the idea that these other factors, social factors, economic factors, political factors, are only going to continue to become even more important in those response efforts. And how can we integrate our efforts, not just within our discipline, but across disciplines, across sectors, across society, in order to have a greater impact in our responses for future pandemics should they occur.
Good morning, everyone. I'm a historian of public health and medicine in China. So speaking from a historian's perspective, I'm going to go back into deeper history and talk about 3 historical echoes of the current outbreak, all of which are concerning. The first, in my first book, I look at the history of nurses in China during China's war with Japan, or World War II, 1930s and 40s. And we're seeing an echo of that today, that nurses, female nurses, at the bottom ranks of a medical totem pole are doing the majority of the labor, and in the media, the people who get the accolades are male doctors, largely. And there has been a lot of criticism of this and noticing of this factor on Weibo. It's a function of the way that the quotas for the volunteers get taken, they come from the central government to the provincial government to the local governments to individual hospitals and clinics, and it's the nurses, who are largely women on the bottom of the totem pole, who cannot say no to such an assignment, and then they're leaving behind families and going to areas of high risk to treat patients with a disease that has no known treatment or cure, without, in many cases, the full proper protective gear. As many of you know, I'm seeing a lot of nodding heads. So at the time in the 1930s and 40s, women were highly visible in the media as the saviors, and it changed gender relations and the possibilities for women. Now we're seeing a situation that's actually worse. It goes against the progressivist narrative that everything is always forever better for women, in particular with gender equality. The situation now, I think, is worse for women. So that's one of the disturbing echoes I see. The other is with medicalized racism and the circulation of the narrative of the sick man of Asia, the Dongyia Bingfu, as I'm sure everyone in the room knows. On February 3rd, a Wall Street Journal published an op-ed from a Bede College professor, Walter Mead, who used this phrase to characterize China's economy as the sick man of Asia, calling it China's the true sick man of Asia. This unleashed widespread criticism on Weibo, circulations of petitions, and in fact, and then the Chinese government responded on February 13th by expelling 3 Wall Street Journal journalists who had no connection with the op-ed and the Bede College professor, but it was a retaliation against this. So in this sense, I actually see, even though it is a recycling of a very xenophobic, very highly racialized denigration of Chinese people as a whole, and many Chinese people feel highly racialized and targeted, it's actually hopeful that people have been able to use the platform of social media to fight back against this in an effective way. So that's a more hopeful narrative. The third is the most disturbing. That is the ways that the COVID-19 might actually echo the 1918-1919 influenza pandemic, in that it began in a fall-winter, and it was pretty strong. At first, it tended to have a very similar epidemiological pattern in the people that it attacked, the age range of the people who were infected and the age range of the people who were most likely to perish. But the very, very concerning thing is that in the intervening summertime, people donned their bathing suits and went to the beaches and relaxed and got hopeful and were lulled into a sense of complacency. And when it came back, it began in the spring, then the summer of complacency, and when it came back in that following fall-winter of 1919, it was utterly disastrous, and current historians of public health estimate that as many as 30 to 100 million people died globally. And we heard this morning from the online sessions of both within China and the US, we could look at other countries around the world as well, where the circulation of information and misinformation and the political use of information is also very, very disturbing, in the sense that we could all be subject to very, very high risk come the following winter if we don't prepare.
So I'm Carlos Rojas. I guess James has already introduced me. So today is Super Tuesday. And there's been a lot of discussion of how the votes will go. A lot of prognosticators trying to predict based on polls and sort of demographic trends who's going to win various states and districts and everything. And the ways that these predictions are discussed, I think, often get it wrong, right? So for someone to say that, I don't know what the prediction is for North Carolina, would say that Biden has a 60% chance of winning North Carolina, and say he doesn't, say Sanders wins or whatever you, then the narrative is often, oh, the prediction was wrong, but that's not right. That's wrong, right? The prediction is that there was 60% chance that he would win, and 40% chance that he wouldn't. I mean, the same way that, if there's a 60% chance of rain and it doesn't rain, that doesn't mean that the forecast is wrong. It just means that it falls within that spectrum. So I think that as humans, we're very bad at thinking probabilistically, and we often tend to sort of take probabilities and see them in binary terms. And I think that the response to COVID, the global response to COVID-19 reflects that. So we see there's been a lot of discussion of China as an authoritarian government and what's done right or wrong, yada, yada. But there's an interesting sort of similarity between, say, China, Japan, the US, and other countries, that they've all followed a very similar response, right? In all three cases, the initial response was to downplay the threat of the virus, to not respond as aggressively to the initial indicators when there would have been a chance of really halting the spread, and then to overcompensate after the fact by responding what would argue is an exaggerated fashion, right? Like in Japan, they downplayed the initial threat, and then now they've shut down all K through 12 schools throughout the country, right? China, we won't even go there, but even the U.S., right? In the U.S. with its one of the most advanced medical sort of systems in the country, they were deliberately not testing anyone that had not been to China or had direct exposure to someone in China, so structurally, they basically ensured that the epidemic would reach a certain threshold before they even started testing people, right? Which is just sort of astonishing. And so that is, I think, a global pattern that I think transcends political system and ideology. And then the final thing I want to say in my 5 seconds, is that there's been an interesting phenomenon that has received some attention, but I think it could receive more, is that, so in the first 2 weeks of February, China's carbon emissions decreased by 100 million metric tons as compared to the same period last year, right? And sort of global carbon emissions have decreased by a very significant degree as well. So this is interesting, right? So this is a direct response to sort of an attempt to sort of preemptively limit the spread of the virus. Think about relative risk, okay? Even if the world had a total saturation of COVID-19, it seems like the maximum fatality rate is 2%, and in many areas it's less than that, right? So that's a lot of people, a very large number of people, but still, it's a fairly finite number of people. I think the general scientific consensus is that climate change over the next several decades will have a devastating impact on world population, global health. Entire cities are going to be underwater, and we've repeatedly missed our targets on limiting carbon emissions. And it's been, it's taken something like COVID-19 to mobilize this kind of short-term response, when what I think is far more important and consequential is to have a similar global response on the large scale over time to accomplish the same thing, but in a more permanent fashion.
Okay, hi there. My name is Ralph Litzinger. I teach in the Department of Cultural Anthropology here at Duke. As James said earlier, my work sort of cuts across labor issues, especially migrant labor issues, concerns with ecology, as Carlos was just mentioning there at the end of his comments, and especially what I call eco-media or ecological media, or eco events, how we respond to ecological events. Thirdly, I'm interested in the circulation of discourses, the sick man of Asia, and the emergence of the kind of anti-Chinese racism that we have seen, which is not surprising, is actually quite predictable if you think of the history of the last 150 years and the way in which the global economy has changed. But I think there's some different kinds of thinking that we can do about why that's emerged now and how people are responding to it. Let me first talk about one project that I have going on right now that's related to COVID-19 and how people are responding to it in China. This is what I would call COVID-19 from below. For the last 8 to 10 years, I've been working with migrant schools, mostly in the suburbs and the outskirts of Beijing. Places like Picun, places like Daxing, counties 30, 40 miles outside of the city center of Beijing. What we have noted in collecting working this with students and other researchers, in collecting all the sort of online diaries, the online vlogs, the stories about doctors and nurses and things like this, is there's been very, very little discussion about how migrant workers in numerous kinds of occupations, everything from delivery service stuff to construction workers, or even kids in schools, in middle schools and elementary schools, have been coping with this, and how their parents have been coping with this. I think there have been a few reports about migrants. One that went very, very viral, which was based right in Kunshan, which was an image of migrant workers who had been turned away from their housing units and were sleeping underneath a bridge. This went viral. I think this is actually quite disturbing for our university that has a university in Kunshan. But in any case, there haven't been enough narratives, enough voices, not about migrants, but coming from migrants themselves. So I'm working with some people connected to a school that I've been involved with for the last 10 years or so, talking to teachers, parents, former students, and some students about what they're thinking about. The second thing I'm interested in, this sort of grows out of my interest in labor and technology, and out of a course that I've been teaching here at Duke called Global Apple. One aspect of that course deals a lot with something that we've all been thinking about, certainly since the last election, Cambridge Analytics, Facebook, all this stuff, and this is the question of AI, privacy, data mining, and the big word, surveillance. You can't have a quarantine in China without surveillance. Migrants can't get into living compounds without surveillance. Some of this is happening. You can't pass through cities or even through airports without surveillance. Having your, and I remember this happened to me in Beijing during SARS, when people would walk onto the plane and take your temperature right on the plane before you could disembark and go into Beijing. This is also another form of surveillance. The agenda now, I don't think, is to critique surveillance. There's plenty of that around, especially with facial recognition, AI, and all this kind of stuff. As an anthropologist, what I want to understand is how people accept surveillance, how people, especially in these kinds of epidemics, pandemics, want actually to be surveilled so that they are more safe. So this is I think this is a future area of research for us to think more, not just about the new forms of surveillance that are emerging. We know about this, it's been heavily documented, but to think more about how people are responding to these, under what kinds of conditions do they allow their privacy to be compromised, if privacy even continues to exist. That's a larger theoretical debate that we're all having right now. But to get into the affective and the phenomenological experience of being surveilled on a daily basis, I think this is new work that we need to do. Okay, thank you.
Thanks very much. I think there's raised a number of issues about the contexts and the interpretive frames that we use to think about the coronavirus, whether it's to put these things in a longer historical frame, whether to think about the transformations in technology that, so now, of course, in China, everyone was used to having their face recognized, and now with everybody wearing masks, of course, that technology's out the window. So we have to replace it with the green, yellow, and red QR codes. And then these are kind of broader ecological contexts as well. And that might also be a context in which to think about zoonotic diseases and the relationship between humans and other animals. So I'd like to give our panelists just a chance maybe to make a brief response to anything that they've heard, and then we'll take one or two questions from the audience.
Could I just say briefly, you brought up the zoonotic issue, and Carlos brought up the climate change issues, which I think was very, very interesting. There have been a number of reports that have been emerging recently that the human animal, human bird relationship has a lot to do not just with, and this is where the racism emerges, is not just to do with the fact that people are eating strange and bizarre foods, right? It has a lot to do with deforestation. It has a lot to do with the ecological compromise of certain kinds of habitats where humans are coming into contact more closely and perhaps maybe more dangerously than we've seen. So it's a kind of subset of a larger climate change issue, but we know that certainly throughout China and Southeast Asia and other parts of the world, Africa with Ebola, that deforestation played a very, very large role in this, and it's something we also need to think more about.
I would also want to chime in on that issue of zoonotic transfer, that global health specialists know this is going to happen repeatedly throughout human history because of global human pressures on animal spaces. And it's really kind of happenstance that it happened in China, outside of Wuhan in this time. So the medicalized racism narratives are just a recycling of a century-plus old narrative that we non-Chinese tend to take solace in, thinking that lends us some kind of control over it. It's really, but that's an ephemeral perception.
And just to add to that, I see that sometimes in talking to people, there's this kind of exotic discussion or description of these exposures that take place. You know, it's some exotic location, it's an exotic animal, and people are interacting with these exotic animals, and thus the risk is that we have a new virus. But it's not just about wildlife, it's also about domestic animals as well, and our food chain, how we produce food, how we provide protein sources for a growing population that has the ability to acquire and purchase those protein sources. And so a broader discussion in public health is not just about how do we look at these habitats or these areas where we have close contact between animals and humans in wildlife situations, but also what do we do and how do we address risks that are associated with domestic animal production as well, knowing that that's there to fill a need of demand, but also has the same risks that we know very clearly of zoonotic transmission of viral diseases.
I wonder, to me as an American, it seems like all healthcare workers, including doctors in China, have a serious sort of lack of credit, and even to the point of blame and even violence sometimes. I've seen in social media that doctors in this situation lift it up. Do you think that will carry over and people will maybe have a new attitude about healthcare workers?
I would hope that would be the case. I would perhaps pessimistically assume that the effect would be short-lived, because the phenomenon of violence against doctors and blaming of doctors is really a symptom of a larger thing, which is the system it's stressed to the point of crisis. It's really a medical system that's asked to answer the demands of a low-income population with high infection rates and a high-income population with large rates of luxury disease. Added onto that, the global climate crisis and pollution and all of this. Yes. I mean, I can't imagine a healthcare system that could keep all of Chinese people healthy. It's kind of like an impossibility. So, of course, and then add to that the layers of economic needs for people to access that system. I would optimistically say there will be such an effect of we have seen that in WeChat discussions, people feeling really appreciative of the volunteers in particular. But I'm going to pessimistically say the effect will be short-lived, unfortunately.
Thank you. Yes, please.
Yes, can I just add a question about women? Because especially through the whole quarantine period, we see a lot of surges of women voices. Also calling out that the whole head shaving movement was kind of a political stunt. Do you see actually that part carrying over after the crisis?
And which part, you mean women being served, being pushed to serve in a certain way?
So there was one female nurse who shaved her head, and then people saw it as an opportunity and forced another bunch of nurses and doctors to shave their heads. And then there's been a lot of criticism about this on WeChat and Weibo.
Yes. I mean, I think that what that is, I know about that. Well, it's sort of like, a woman, a female, the message I take from that is, female nurse who leaves behind, let's say, a family, most likely, to go into a place of risk is not yet doing sacrifice enough unless she takes a Buddhist tonsure. It's like forcing her to be the most self-sacrificial person on earth to even get any kind of legitimacy and a face in the media. The nurses largely got a face in the media as being shaven, having their heads shorn. So I think it's again, it's a symptom of a larger thing, which is, the roles that women in particular are pushed into in the medical system. Although I do want to make clear that I think China's medical system also has a more unique aspect, which is that midwifery and obstetrics and gynecology are more in the hands of women, which is a different trend from other countries. So just to underscore that it's not just China that suffers from sort of, sexism and hierarchy in the medical profession. This is a universal thing. But I would hope that women are allowed to have more of their own voice. And I have seen from friends of mine that privately circulating things on blogs and WeChat, of course, in that regard.
Well, just to add to that quickly, I think another dimension of this that hasn't perhaps been talked enough about are how people with other kinds of diseases are being treated and turned away from hospitals. Now, this has improved, we know, in the last 2 or 3 weeks for sure. But I have a colleague, for example, in Wuhan, whose father has stage 4 lung cancer, who has not been able to get any treatment since all this started, in part because doctors and nurses the hospitals are just overrun and they can't get in, there's no hospital beds, right? And so this poor man is essentially slowly dying at home because he can't get his medications and he can't get his treatments. And there's more and more stories popping up about how a crisis like this and the pressure on hospitals and the pressures on doctors and nurses and the whole medical system means that other kinds of people have to pay. Other kinds of people who don't have the flu, don't have the virus, can't get the right kinds of treatments. And this has been a big issue in cancer communities and online discussions of people with cancer about how they have lost access to their treatment over the last six weeks to 2 months.
Yeah, to follow up on that point, and also to follow up on Nicole's comment about midwifery and sort of the role. I mean, one of the kind of more specific sort of population that is experiencing these kinds of pressures, there's a New York Times piece on this a week or two ago, are pregnant women, right? And that in many cases, maternity hospitals have been completely turned in Wuhan or Hubei have been completely turned over to treatment of the virus. And then the second thing is, so that's a particular, a population that knows that they will need medical attention in the immediate future. But then the other thing is, Nicole mentioned that I think you said it's sort of an impossibility to treat, to have a medical system that would effectively treat, a population the size of China's. I'm not sure that, impossible is kind of a big term, but, and obviously you can scale anything up or down, but I think that one thing that is really, that we already knew but has received a lot of attention in response to the COVID-19 outbreak is the lack of a primary care system in China, right? Where it's basically hospitals that are the primary point of medical contact for most of the population. And that I think is sort of exacerbating the underlying problems.
Class dimension.
Yeah.
I'd like to introduce Chen Chen. Some of you may have read the excellent article that she wrote in Duke Chronicle. So perhaps Chen Chen, perhaps we'll start with you.
So in the following weeks after the coronavirus first broke out, I just noticed like the dialogue about coronavirus on campus and like in general was quite like negative and not really like treating the people in the situation like they were like actual people. And I remember like I was in a car and like someone was talking about coronavirus and I mentioned that my family was from there and the tone of their voice just changed completely. And I just like stopped to think like, why does the tone of your voice change just because my family is from there? Because it really doesn't make a difference if my family is from there or like someone else's family is from there, because someone's family is from there or is there, right? So I was like studying for my biology midterm. I just couldn't focus. So I wrote this article just out of frustration, I think. And it was probably like midnight. And I just really aggressively typed it out. And then like the responses I got for my article were actually quite surprising to me, because I think that like Asian Americans, when we like grow up in the US, we live that like discrimination that's all like coming to the surface in this outbreak. So like none of it's like really a surprise for us, but I was surprised at all the like really positive comments I got, and I was even more surprised that I didn't get a single negative comment, because I feel like the Chronicle always gets some weird negative comment on their posts. And I think from that I realized that people do want to feel connected to the world issues. It's not that people just don't want to feel anything human about any situation and they just want to look at it from afar. I was really just taken aback at how much I saw people like both connecting to what I was writing about and also just trying to connect to this situation that's like on such a large scale and like almost like unimaginable. Like even for me, like who's closer to the situation, it's still hard to like really like contextualize and like see what's happening. So I think one lesson that I learned from that is that I've like done a lot of like, you know, work in journalism, whether it's working for the Chronicle or like previous internships. And we always say like journalism is like the point of journalism is to keep people informed. And I think that after like this whole situation, I really like realized that like beyond just informing people, there's a real need for journalism that like engages and connects with people, because like information, we all know that people don't really like it. At least a lot of people don't really care what the real like information is, and it's also hard to like take in so much like information. Like I can barely keep up with the outbreak. There's just so much news on it, and I think I learned from writing my story that it's really important to have stories out there that really like make people like stop their like busy lives and just like think about what's happening and think about like the people there and like think about how you can connect with them and not like, you know, ostracize them. So
Thank you very much. So, and we know there have been a number of projects of studying the experiences of people in China, and so Yenping, maybe you could talk to us a little bit about your project.
Yeah, in last session I talked about my reading experience of Wuhan residents' online diaries. So I summarized like 2 keywords for my reading, try to conclude or synthesize this information. The first one is the everydayness. So the most stuff we are seeing online are really the most ordinary or like quotidian or like very unnoticeable stuff, really very detailed activities in our life, like people are working, driving, talking, or like eating, something like that. And also then I realized why this kind of a sense of everydayness becomes so noticeable or stand out. It's because this everydayness is embedded in a state of exception. Because the Wuhan was locked down since January 23rd. That means the city of like 14 million people, they are kind of locked in this city. Then also all the stores or like banks, all kinds of malls, they're all closed. Like the only open places might be just the hospital or like the market, just to meet the basic needs of people. Then I particularly noticed one emerging group of people, the volunteers, who are sending the medicines around the city or sending all kinds of face masks. Of course, it's important. Then the food and also the hotels and the restaurants, they're giving away their places and their food for free to the doctors and the nurses. Then actually, I was gonna share my personal experience as an international student. I'm gonna keep it short. So, because I do see the connection, because both like people, Wuhan residents in the epidemic center and me as an international student, we're both, I guess, geographically fixed. I know one student in my program, she went back for Spring Festival, then she couldn't come back to the States to continue her study. Then also, of course, I'm not allowed to go back to my country. So in these cases, the online space becomes really important. So I do see like how social media can be so dramatically influence or like inform our actions. So me personally, I didn't really realize how serious this epidemic can be, but my sister, who is really kind of like digital obsessive, she's really into social media. Then she has been really closely following all kinds of information or updates online on Weibo, WeChat, all kinds of platforms. Then she's so terrified about all the situation, and even like more terrified than my parents in the place. So I do see like how social media can be so dramatically change how we perceive this case, even though we are not there. Then in this case, the face mask becomes really important, because that is something to my sister. She thinks that is kind of like the only solution, or like the only thing that she can control to I don't know, like not like solve, but like to mediate her fear or like anxiety in the face of this epidemic. So she ordered a lot of face masks to my parents and also to me. So yeah, this is just like from my perspective as an international student. And also there's one thing that mentioned both by Professor Barnes and Professor Lintega, that is the racism, which is also very outstanding in this epidemic. It's turned out something very like a racist disease. Cause from my friends' experience, some of my friends, they were like, I'm afraid, I don't know if I should wear a face mask, especially like here, like no one is wearing a face mask. Then my friends were like, I don't want to be hit because of wearing his face mask. So like everything is kind of degraded to like a racism. Then also this kind of racism bounce back becomes like nationalism or like patriotism, because there's some slogan, almost like something slogan like fight the virus, not Chinese, something like that. So yeah, just like some key points that I think very interesting in this discourse.
Thank you very much, Yenping He. Now I'd like to turn to Professor Benjamin Bacon. Professor Bacon is a professor at Duke Kunshan University, and he's also a member of our Health Humanities Lab, which is also being co-directed by Professor Benjamin Anderson, who was the first person to speak in our panel. And this lab has created a project for students to archive and record and archive document their experiences of living with coronavirus. And in the previous panel, Ben, you outlined some of the idea behind the project, but maybe now I wonder if you could talk perhaps a little bit about what you're aware of in terms of the student experience already.
The platform is basically a way that students can storytell or tell their different experiences using GIS technologies and rich media. So really quick there. So sets the stage. So the thing is, it's a really flexible platform. So the students that I've been interacting with, mainly through my audio documentary course and design history course, are really looking at this as ways to utilize not just telling about kind of their experience, let's say moving from DKU to their hometown, but really like, hey, this is what my life is like. This is how I interact with my family every day. These are kind of like the hot topics happening on Weibo. So one student's really looking at how these different trends and how those trends are affecting their daily life and how they feel. So really kind of looking at this internal kind of dialogue of what's happening there. Just from personal experience, my wife and I came over for Chinese New Year's to the States and got stuck here, and it became a way to really express that kind of fear and kind of social anxiety that she was feeling, we were feeling. So the students are really kind of taking advantage of it in these types of ways. And what we're really hoping is to obviously get more students and community involvement with it. Does that answer your question?
Yeah, that's right.
So,
yeah.
And perhaps I'd also like to perhaps bring into this discussion Dennis Simon. Dennis, we're going to hear from a little bit later in his kind of expertise capacity in terms of Sino-US relations. But of course, also Dennis is the Executive Vice Chancellor of Duke Kunshan University and was closely involved with all of the decisions surrounding what has happened at the university, and perhaps better than most people here has some sense of the overall the experience of the students and also managing that kind of situation. I wonder if you maybe want to add to this conversation here.
Sure. I mean, it's been a fascinating experience because we've had approximately 60 students on campus. There were, I think, 12 or so from Hubei. They have not been allowed to return home because of the situation in the province. And then another 40 or plus students who decided to stay for whatever reason. On January 31st, or in and about, we actually gave them a chance to leave because transportation links were being shut down, and the students were offered a chance, and almost to a person, those students decided to stay. So we've had, the reason why I say approximately 60, we found, for example, one a young lady was with her boyfriend that had been hiding away on the campus, and some days he was counted and some days he wasn't counted. We had another young man who went over the wall one night at 3 a.m. We found him in some service hotel. He seemed to be alone, but who knows? And then one student just the other day said, "I'd like to leave." And we allowed that person to leave, and they cannot come back unless they would have a 14-day incubation period. So the students as a whole, I mean, their experience is such as that they actually keep to themselves because the rule is that you're not allowed to congregate in large groups. So a group of 10 would be, in a sense, inconsistent with government guidelines. And so the student experience has been one in which they've sort of had to find a lot of things to do, and everyone's been joking, but watching movies and playing video games and all sorts of things like that, that's really been the mainstay of their survival. They can't eat in big groups either, so we have to have staggered meals. We have about 10 or so staff members on campus, and so the staff members try to interact periodically with the students, but still the students are, thank goodness for the startup of the online program, because I think for the students who've been stuck on campus, this has been almost a savior for them. It's really given them a mission and a purpose, and I think they've excitedly received it. The bigger thing that we don't mention, we talk about the faculty, we talk about the students, but we don't talk about the staff enough. And the staff that really came to the top of the heap on this, they really have performed unbelievable, and they've been on campus now for since middle January, and some of them did not even go home for Chinese New Year, so they've actually stayed all the way since the end of the winter term, all the way through. So Chancellor Feng, to be very honest, is one of those people who's been on campus now for 2 months. Roger Fan, our Director of Operations, has been on campus for almost 2 months, but he can go home, but he stays some nights and sometimes he goes home. But those people really are the ones, when we invoke the emergency task force, those were the people that actually rose up and said, look, I'll stay. And they did not go home, and they've been actually managing the campus. We need someone literally to turn on the lights every day. We need someone to feed, and so we take the kitchen staff to their dormitory. We pick them up in the morning, and we basically ask them at night, please don't go out and go anywhere, so that you can maintain a semi-insularity from the rest of the society. I mean, knock on wood, we've protected the campus. No one has come down with the virus. One young lady was feeling ill, but the most dangerous place to go in China right now is to the hospital. And so there's a kind of contradiction here. If you're scared to go to the hospital because you're going to get sick, you may have something wrong and you don't tell anyone, and then all of a sudden the virus starts to come out. On the other hand, if you're well and you go to the hospital and there's virus contagion all around, you might end up coming back sick. So we told people, if you go to the hospital, I'm sorry, you have to have 14 days before you can go back. Oh, that was scary to a lot of people. Again, thank goodness there wasn't an incident, but you're caught between a rock and a hard place. The other individualized name I haven't mentioned, but Wayne Fan. So we have a director of emergency affairs, and that guy really, I mean, I think he thought he was only hired in case we had lab accidents, a small spill here or somebody. He never imagined, what his job was going to entail. And again, there's another person that literally stepped up. So when the story about all of this gets told and the experiences, it has to really be this triangle of people, the students, the faculty, and the staff that really have been the ones to rise to the occasion.
Thank you. Since I'm sitting here, Tim, I know, wanted to say something. So I'd like to introduce Tim Smith, who is the lab manager for the Humanities Research Center, and he's been heavily involved with all of our students, helping to keep them on track with all of the various projects that we're doing. So, Tim, just a quick word from you.
Yeah, one of the things we're exposed to, there's many dimensions, of course, to an emergency like this. One of the things, because we're in the midst of dealing with students on many different levels, we're able to observe things of more of a psychological nature. So, for instance, what's the impact of isolation? What's the impact of disruption in terms of your hopes and your dreams? You go to a school, you've got 400 very interesting friends from all around the world, and all of a sudden you're kind of stuck in your room and you're not supposed to go out. So that all feels like it's being jeopardized, and in fact it is. And additionally, we have then other students that we're in touch with who are, again, in this very interesting environment one day. The next day, they're stuck in their basement in their family's house, where the only interaction they have is with their parents. So that's the last thing that these kids ever expected or wanted. And in many cases, so you could picture, you put yourself in that position. So these are, we end up having a lot of interactions with students who are surfacing these kinds of, very obvious types of concerns and reactions. One question I wanted to surface from the online chat that we had earlier today, and this is perhaps more directed toward the voice of the students. So there's a paradox, and that is that we have a desire for more immediacy and more interaction and connectedness with people, rather than just seeing pie charts and talking heads on the news. So this is seen as a good thing. On the other hand, most people who are exposed to that for a while begin to also experience more trauma of an emotional sense, in that they are exposed to storylines, they're exposed to things that really kind of reach out and grab their hearts because they can put themselves in that position, or maybe it's their friends. And so the immediacy of being able to get online and talk to your friend who is in danger or exposed or whatever. So my question is, the paradox of more of this kind of personal contact, while at the same time actually generating additional psychological trauma, and how do we kind of massage that relationship with social media to perhaps create additional resources, or I don't want to give my answer to my question, but
maybe let's ask Chen Chen and Yanping, perhaps if you want to respond, either one of you would like to respond to that.
I think I've been really depressed about. I'm trying to find a different word, but I've been kind of like depressed about what I've been reading. Especially, I've been tracking the statistics, and so I kept refreshing the web page, so I see the death toll increase. So I realized, oh, when people died, another people died, then behind these people there might be a family. Like many people rely on this person, this individual, and all kinds of stuff. Like this individual has his own story, his own dream, his own hope, and then something unexpected happened to him. Then that's it. Like everything's end. But I also, there is also something very positive in the diaries I've read, especially those videos, those vlogs taken by the volunteers. So these people are really doing something good, like they don't want anything back. They're just doing to help people they know, like to help people who are living in the same city. And these people were like, there's no way to escape. We don't want to run away because this is our city. It's kind of like our responsibility, or like, I don't know, maybe not even responsibility. We just want to save this city. Yeah, I guess the balance or mediate is that there's always something depressing, but there's always something very positive. And we also see the situation in China is improving, and like more and more people are cured, then get out of the hospital. Yeah, so I guess, I don't know.
Thank you. That's great. Thanks very much. Chen, perhaps you want to add something?
I think in regard to social media, I have like kind of a weird place in that because my mom used to be a physician in Wuhan and she went to medical school there. So she's added me into her like alumni groups. And it's, I think it's really hard to see like other physicians talk about someone who's just passed away as like a doctor. Like every week or so, there's like an entire chain of messages just saying like, rest in peace, this one classmate or like this one doctor. And I think that's like so like difficult to see because like you not only see that like a doctor who is like working in this outbreak that they pass away, but you also see the reactions of people, like their colleagues, like a lot of them in the same position and like facing the same risks, like staring down like this, like one of their classmates or colleagues who just passed away, but also like some of them are far away and like working in other countries, but some of them are right in Wuhan still and also just working alongside someone who just passed away. So I think in terms of social media, it's also interesting how it's like being used in like smaller circles of people who are like really close to the problem.
Thank you very much, Dennis. I think you wanted a short comment here.
One of the things that we've seen throughout this is simply having the availability of mental health counseling has been helpful not only to students. I'm really happy to say that students have taken really big advantage of this, and we've even increased the staff at the very beginning. Just we had a sense that this would grow, and the demand has risen. But also at the same time, we've now known faculty are taking advantage of these availability. Duke has been helping with that. And then the staff as well. Surprisingly, we've now seen time being booked onto staff with the availability. But this has been, I mean, this having a sense that you have somebody to go talk to and that someone you can trust, and particularly part of, for example, in our case, the DKU family, is something that really has been extremely, extremely helpful.
Absolutely. That's great. Thank you. We have maybe time for one or two questions. We have one over here.
We all mentioned how social media was important for you to engage with people who are really affected and empathy, connected with them. So do you think that this type of empathy can be amplified throughout the international community if there is no great firewall, basically secluding the voices of 1.4 billion Chinese people within their country? It's like, I mean, are people gonna in the world gonna be more understanding towards the day-to-day difficulties that Chinese people are facing if they can hear from their authentic voices, basically on Facebook and Twitter, where the rest of the world is residing? So that's, I know I figured that was, but that's.
I feel like, say, like Facebook, Twitter, Instagram, like people in China still use it through VPNs, but not really like the more, like more of like the middle upper class people in China. So, and I guess like the format of social media in China is quite different. Like WeChat's just set up very differently. It's not as public. But I'm not sure like what the outcome would be if they were available, because I feel like whenever a disaster happens to a country that is non-Western and like has people of color, like they can be on social media and like saying like their voices however much they want to, but those voices still aren't valued. So I'm not exactly sure like how that would like impact the situation.
So I've been watching some videos on YouTube as well and try to compare those on Weibo, but honestly, I didn't see like anything so dramatically different between these two platforms. Although there might be like a more critic of Chinese government on YouTube, which might have also been released on Weibo but might be censored. And I guess back to your question, I think in many cases it depends on how you read the materials and also the sources of your materials. Like even if in Weibo the publisher really matters, if you read those published by the government, and if you only read this, that is really like biased information, right? But if you also read those written or like recorded by the ordinary people, so you can get a more balanced view of the real situation. Maybe no real situation. I don't know if there is a real situation. Anyway, one thing that I noticed in my reading of the Wuhan residents' online diary is that there is really a noticeable absence of the government voice or like government officials or like all kinds of assistance from the government. It makes me feel like the ordinary people there, they're really more grateful for the local volunteers, like with borrowing a Chinese word like the 民间 volunteer rather than the government assistance. Yeah, I guess it's necessary to read, to combine different materials from different sources.
Talk about this impact about global education and exchange. Number one, we've seen a rise of right-wing nationalistic governments around the world. Number two is actually the CDC this morning issued a recommendation, quote unquote, about, it was pretty vague in the wording in terms of encouraging higher education specifically to cancel exchange programs and to send people home. It was worded, I think, in a very political way. But I'm just curious about the panelists' perspective, not just from the US context, but from the worldwide context in terms of how this might affect global education and exchange.
Well, that maybe it's a good segue.
Yeah, I think that is maybe. I was about to say the same thing. I think it's a good segue. Maybe let's hear from the people who have some expertise in international relations and Sino-US relations and also politics in China. So I think we've surfaced a number of these issues. And perhaps first we could go to Robert Delaney. So Robert is a kind of special guest who's come down here from Washington, D.C. So thank you very much for participating in this. Robert is the North America Bureau Chief of the South China Morning Post. So Robert.
Yeah, thank you. So I guess instead of doing much in the way of an introduction, does anyone here not know what the South China Morning Post is?
We love it.
Everyone knows, right? Sorry? Yes, great. Okay, good. So I won't.
The online chat, we love it.
Gotcha. All right. So Yeah, so obviously from where we sit, we are, the South China Morning Post really tries to present the news and analysis in a way that doesn't necessarily mirror the perspective that many of the Western media have about China. Also, obviously, we don't mirror the perspective that the mainland Chinese government has. So maybe if I could bring it down to a particular example of how we approach this issue that we're talking about here. So it was about maybe 2 weeks ago when we, on a daily basis, we were tracking the new numbers that the Hubei provincial authorities were publishing about the new confirmed cases and the deaths. And on one particular day, the new cases rose by tenfold. It was a massive increase. And so I'm very fortunate in that in our office, we have a rotation program. So we bring reporters from Hong Kong and China in to work in the DC Bureau for 3-month stints. So one of them is working now. She's excellent. Her name is Sissy Zhou. And she was looking at the numbers. She was on top of the numbers all the time. And the new numbers came up, and she read me the numbers, and we're getting ready. We have a templated story ready to go. And I said, what? And then and then I looked at the numbers. And then everyone in the office looked at the number and said, well, if we publish this, then what if this number is inaccurate? Because now everyone's getting very panicky, and if we publish a story that says their numbers are rise by tenfold, what are the markets going to do? What are the implications? Can we look at it again? You know, we all looked at the numbers about 5 times. Anyway, the whole point is that we did eventually publish it, but you know, and I think a lot of the other media followed it. It became the story of the day. So the problem is when you follow up on that, you know, the first version of the story is just very straightforward. Here are the numbers, it's a tenfold increase. And then, of course, we read deeper in the government notification, and it says that they've changed the diagnostic criteria that they're using. Okay, so that's the example. So we update the story with that information. But it's very vague. We don't know exactly what are the new diagnostic criteria. So then, as you're trying to develop the story, it's like you could go one of 2 ways. You can ask, you know, as they've changed these criteria, is that an act of responsibility, or is it evidence of a cover-up? And so you're kind of in the news business, you're kind of faced with this. Are we going to go with the sort of the bad China narrative that we hear all the time in the Western media, or are we going to acknowledge that there had recently been a World Health Organization team that started touring through China about 2 days before, so perhaps that was part of it. Maybe this was just a determination by the government that they needed to be as upfront as possible, and that's, you know, it's not necessarily a matter of trying to manage the message. It might have just been a more scientific way of counting things. Anyway, the point that I'm making is that when we're trying to decide, is China being good here or is China being bad here, it's very difficult, and sometimes it comes down to the particular moment when you're going to make a judgment call on what is going on behind the scenes in China, and it's never very easy to do. And I appreciate Kunshan when you were talking about information. It's really important to get the right information out. I guess, you know, the point that I want to make is that this situation is evolving very quickly. And because it's evolving very quickly, it's very easy to mischaracterize exactly what's going on. And I would just hope that everyone would keep that in mind as they see the newest reports coming out about it.
Thank you very much, Robert. Yes, please just.
Funny story about the example you just mentioned. I remember when the New York Times came out with the first article. I think the headline was like, something about the numbers increasing a lot. And I remember I like woke up from a nap. I looked at my phone, just like rolled over, groaned, and went back to my nap because I remember the night before my mom called me and we were just chatting, and she said that, you know, like her classmates mentioned that they're changing the counting criteria because it's been really hard to like get the tests to people like in a like a timely fashion, just because there's so many tests that need to be done. So like from that perspective, I saw it as like doctors literally just could not give these like tests in time. So they changed the criteria so that they can count more of the cases. And then I remember like 3 hours later, the New York Times came out with, oh, it's because they're counting differently. And I'm just like, ah. But yeah.
Thank you. I'd like to introduce Professor Andrew MacDonald, who's Assistant Professor of Political Science at Duke Kunshan University. Andrew?
Yeah, so I want to follow up on a couple of threads here that we've been discussing. So Yenping, I think, had some really interesting, made a really interesting observation that that overall Chinese people feel, or the discourse online has been mostly feeling very sympathetic to the doctors and frontline staff, and not really being, not necessarily anti-government, but like most of the heroes of this story are the frontline workers, right? Which is a little bit different than the case of this, for example, the Sichuan earthquake, where I think a lot of the credit was given to the PLA, first responders, right? And that was seen as like the government being effective. So one of the kind of questions that continually comes up online and elsewhere is like, is this existential or serious threat to the Chinese regime, right? And you know, the Chinese regime has proven to be resilient through a number of crises: the Sichuan earthquake, the Wenzhou train crash, you know, on back to Tiananmen, and you know, all the way further back. And you know, I don't think there's any sign that this is a real existential threat, but I think you can start to see some of the threads coming in some of this online discourse about how, you know, in the long run, like what Melanie Mannion pointed out in our last online discussion, is people expect the government to be nominally competent and provide things for the people, right? And this is a case where the government has clearly failed to do that in some important respect, right? Maybe the quarantine has worked in the long run, and maybe I'm sure the Chinese government will try to take credit for the quarantine as being successful. But I think attempts online for the government to try to claim credit for some time of success in this has really not taken hold. Like, people don't buy it online, right? So I don't think this is going to cause the regime to fail or anything, but you know, one of the things that started the decline of a lot of the Eastern Bloc countries in the 80s was this kind of pervasive cynicism about the quality of governance, right? And so this doesn't necessarily, I think, point to, you know, you don't want to extrapolate too far forward, but I think you can see some elements of this leading to a more 1980s type solution among, you know, some of the Eastern Bloc countries. Another kind of thread that I wanted to bring into this is this information discourse about who do you believe in the government, right? So we've kind of having this discussion about who is trustworthy in the discourse right here. And even if it's the case that, you know, the story is being, you know, the government is actually being honest, the question is, how do you know if you can trust the government, right? So even if they're doing the right thing, which in this case they might have been updating the reporting of number of cases for good reasons, right? It's very hard for people to know because of the government's long, you know, obviously the internet's controlled, the discourse is controlled in China, but particularly in this case, you know, I think one of the difficult things, and I think people online in China struggle with this as much as we do, is how much, you know, again, you kind of trust the government to protect you in some way, or you hope that they protect you. So you kind of have this ambiguous relationship with the government in that you're hoping they protect you, but you also suspect they're lying to you all the time, right? And so, right? And so, or like you have it in at least the back of your head that like, and so, you know, you're kind of stuck in this, you know, which I think exacerbates some of these psychological pressures that people are under, because they're like, okay, the government says it's this serious, but how do I know the cases aren't double or triple what they say they are, right? Like you know, like you know, if you're a business person, you're like, you know, I'm already close to going bankrupt. My business is already, you know, in big trouble, or not big trouble, but, you know, could be in big trouble. And the government says, well, this is going to end soon. And you're like, maybe, should I believe that? Should I call back my workers and start production again, right? Or if I'm a student, you know, like, when can I start my studies? And if you don't believe what the government says, this is just going to compound this kind of psychological difficulty you're facing.
Thank you very much, Andrew. I'd like to move to Dennis Simon.
This was a discussion yesterday on the China Global TV Network, and Professor Ma Liang, who I know is in the School of Public Administration at Renda, and he says, China's responses to the outbreak of the COVID-19 disease reveal the significant institutional advantages of China's national governance system. The Communist Party of China is strong in steering the nationwide campaign against the epidemic emergency, and the party state machinery works quite effectively in mobilizing the whole country to deal with the COVID-19. End of quote. So I think that's an important statement, that the machinery of the state has already now started to mobilize. Last night and the night before, I'm watching the CNN, and you watch the CNN and you watch the chaos going on in the White House and the National Institute of Health and the CDC. And you have to believe the Chinese government is watching the same thing that we're watching. And it's just sort of like the global financial crisis. The global financial crisis, 2 days before, we're lecturing about the benefits of our system and open capitalism, et cetera, unbridled capitalism. And then all of a sudden, the whole global economy goes into chaos. And then we can't say boo to the Chinese about their system because our system proved so corrupt and so disastrous. So there are many things that are going down now. The interdependence of that the internet has created is not just a phenomenon, of course, inside of China as an integrating mechanism, but the cross-border transnational nature of this information now is moving. And we're going to be in the next few months in a very interesting propaganda war, in effect, between the two countries. Just like we imposed this 14-day quarantine on Chinese coming to the U.S., as the virus starts to spread, I am sure they will impose a 14-day quarantine, not a self-quarantine, but you have to be in a third country because the U.S. will be too dangerous to come from. And so that's one big point. About a week ago, I was at the AIEA, the Association of International Education Administrators, and there were 4 panels all about China, and of course, everyone was about the COVID-19. And I think it's exactly, Li Chen is exactly right. Every international education administrator, vice provosts, and typical people, they are all extremely nervous, and all we're talking about withdrawing not their programs only from China. At that time, a week ago, it was Asia pretty much, and then NAFSA just made an announcement that clearly now there are indications that almost all the study abroad programs for this summer might in fact have to be curtailed. So this is a massive impact of huge nature, not only financially, but again, as all of us know in education, these kids' time, first semester junior year or second semester junior year, or summer, you lose that opportunity, it doesn't reappear again. And so this is going to be something that's going to be costly in terms of the experiential part. And then finally, just to think about the thing we haven't talked a lot about, but the global supply chain issues and the impact. And you watch this. So I've watched a friend of mine's company. It's a multinational company. They were closed all the way up until last week. Then they started a staggered coming back, work Monday, Wednesday, Friday. I don't know why Monday, Wednesday, Friday. This week they work Tuesday and Thursday. And there's a sense that there's a dual pressure. There's dual pressure from the shareholders, coming from the United States, of course, and there's pressure from the Chinese government. We've been told, for example, that K through 12 school will get more attention in terms of restarting up than the universities. Why? Because parents can't go back to work unless their kids can go to school so somebody can watch them. And so you got to get K to 12 implemented and returned so the economy can start to get booming. And every day, whether it's South China Morning Post or some other network is talking about how the Chinese economy, GDP, is going to go down another half point, quarter point, or 1 point, et cetera. That's, it already was being structurally moved in that direction downward in terms of the growth projections. It's a little bit scary for it to go down another whole point or so if in fact this is going to happen. And it's raised the question in every company's mind, how dependent are you going to be on the Chinese sourcing for your global supply structure? And are you going to have many more critical facilities outside of China than you would have inside of China? And so the relationship between the U.S. and China now was already going in a disengaged direction. This could possibly help to even further facilitate that disengagement. That would be, in my view, almost catastrophic also, because we were trying to push back against this, a lot of us, and now this is going to serve to even make it economically justifiable to have further disengagement, and that could be a big problem.
Just a question for Dennis or Andrew or for Robert. One thing I've thought a lot about is, since Trump was elected, we've been in the midst of this trade war, right? We've had all of this anxiety in the U.S. over Huawei, right? The arrest of Chunwan Mum, what was her name? That issue, the debates over 5G and who's going to control 5G, pressure that the U.S. is putting on different European countries, the accusations that are coming out of the U.S. government about Chinese spies, especially in the tech industry. All this stuff's been going on for two or 3 years. There's been a kind of intense propaganda war, right, that has echoes of the Cold War, but in a new sort of, a different kind of integrated global context. I'm wondering, from either watching this from Hong Kong or from the Kunshan being inside of China, how you think about the relationship between the reaction, right, especially the bad China narrative, right, that reaction to the coronavirus compared to the kinds of stuff. I mean, for me, it seems like it's just an extension, right? And in some ways, the reaction to the coronavirus is a projection of all these anxieties about the rise of China that the Trump administration especially has trafficked it in very, very dangerous ways.
I mean, I would say that the biggest problem that we're facing when we're trying to analyze how this coronavirus is going to affect an already very fractured U.S.-China relationship is so difficult because let's just take last week, for example. And last week, President Trump, in his press briefing about the coronavirus situation when he was appointing Vice President Mike Pence, he said that he had a very long talk with Xi Jinping, a phone conversation, and he said, quote, "You can count on the information, I think, or you can count on the numbers that the Chinese government is reporting." So on the one hand, the president is speaking in very warm, supportive language about the Chinese about Xi Jinping. At the same time, on every other level just below Trump, you've got Mike Pompeo saying that China's the greatest existential threat or something like that to everything. And you've got you have a whole bunch of lawmakers, Rick Scott, Marco Rubio, Josh Hawley, all just sort of banging that drum about how irresponsible China is and what a threat it is. You have all of the Department of Justice indictments that are coming out. They're coming one after another, indicting Chinese entities for espionage and other, we won't go into analysis of how reliable these indictments are. And then, of course, you've got Huawei, too. So I would just say that this is a very long way of saying I can't answer the question because it's not clear who's going to prevail on this. Is President Trump going to prevail? Because President Trump started the trade war, and it's very clear he just wanted to realign the trade flows. But things just got way ahead of what he wanted, and all the rest of Washington really took up the anti-China mantle, and the grievances kind of went way beyond what Trump was thinking. So I think the question is whether or not he's going to have the power to. I mean, we know it's so obvious that Trump has a real kinship with authoritarian leaders, and so it's the question is whether or not he's going to bring that affinity to bear and prevail with that, or is the rest of the traditional foreign policy community and State Department, are they going to prevail in their efforts to really to disconnect from China?
Thank you.
Well, I'll just offer a comment. Another theory on the big spike in the end of February about those reported numbers is that the expansion of the reporting criteria was in anticipation of the switch of experts who were fired from Wuhan and replaced with external experts so that they could preside over the dramatic decline. Right, so it's kind of configured that way. That's another theory. Kind of in the middle of your bad China versus...
Right.
It's kind of a comment that Dennis made earlier about the CDC being in disarray and Chinese sort of maybe laughing a little bit now and jokes on us now in the US maybe. We have, it looks like community spread in Washington State that we're way behind and catching up on. And the WHO has recently made much of celebrating China's success at keeping the outbreak or getting to the downslope of that epidemic curve. How will we tackle this in the United States while keeping civil liberties in mind? Looking at the China model, not having exactly the same tools, being a step behind. How do we balance those successes in China against our model and our values here in the United States? I'm curious to hear thoughts about that.
I'm not sure they're successes. I mean, there's a narrative with the WHO's praise of the of China's response that I think should be looked at critically, right? I mean, I think there's a lot of evidence that by cordoning off Wuhan and these other cities, that you're really, in many ways, you're sort of exacerbating the dangers to the. Sort of like the Diamond Princess writ large, right? It's a very complicated question, and I defer to my scientific colleagues but I don't think that we should definitely say that, China has been successful. How can we replicate that authoritarian response?
Yeah, something I was brought up at the earlier online discussion was that if you want to say that China has an advantage, one of their advantages that you kind of raise is this. I hesitate to use the word advantage, but they don't have to respect civil liberties, right? So they can just lock people up in their housing complex and no one can leave, right? And you can. I defer to the public health people about how effective that is, but they are certainly pushing the narrative that that's been effective, right? And that's in the popular consciousness, it's believed that that's effective. And so the U.S.'s advantage, if you want to simplify it, is that people have. There is this idea that people here can, to at least a larger degree than in China, trust the government, right? And that this free flow of information is somehow key to resolving the epidemic, right? And obviously, one of the downsides of having Trump as president is he's, up until recently, viewed this as a public relations problem rather than a public health problem, right? And limited the flows of information, which should be the strength of a kind of open system where people can trust the government. So, and the other thing that we haven't talked about is that, China is still a developing country, right? It's middle income, its GDP per capita is about the same as Costa Rica, roughly, right? And Wuhan's, richer than Costa Rica maybe, but maybe not by a lot. And so, it's public health facilities. You talked about, primary health care facilities are just not at the level of the U.S. The U.S. has a deep reservoir of public health experience that hopefully the Trump administration will draw on, and I don't want to say wealth, but infrastructure that they could throw at the problem. Maybe this is something a little bit more up your alley, Ben. But
in terms of the discussions that are ongoing about the effectiveness, there's really no objective way to really evaluate the effectiveness of a quarantine of this size from a scientific perspective. Now, there are some qualitative ways and some different methodologies you can do, but if you're talking double-blind randomized control trial of a city the size of 14 million people, and you can think, and people raise the question, imagine quarantining Chicago. New York, in London? Would you be able to do that? So this gets into the political discussions. So I think when scientists are asked, or when public health officials are asked, is it effective? I really don't think if people can give you an answer and actually pick a side, they're going to be biased from their political view or biased from whatever objectives they have in the long term. So I think it's really important to state that this is really unprecedented in intervention from a public health perspective. Now, we could get into some discussions about smaller quarantines, their effectiveness, and then this ties into ethical issues of, is it ethical to detain people, et cetera, but I just really think it's challenging to really put a qualifier on whether or not it would work or not work, or can it be replicated if we did the same thing in another country? Would you see the same things? Because the political component is such a critical key aspect of this intervention. And then the one other thing I'll say is people talk a lot about this idea of the response, like even evaluating the response of public health interventions, as if the Chinese government had a prescribed response just sitting in the shelf, and all they had to do was pull it out and implement. Well, I tune it to the analogy of like karaoke. You can go, you pick a song, and then you're judged on how well you sing that song. But in this case, we don't have a song, we don't know the music, we don't even have a microphone. All of that is being created in real time. So we talk about diagnostic testing, the criteria for how do we score cases. All of that is happening in real time. And you have a whole public health infrastructure that's trying to mobilize, including a health system that's overwhelmed, people who are trying to figure out what this virus even means on a clinical perspective, all these very complicated pieces trying to coordinate together. And I'll say that if anything, the United States and the other countries in the rest of the world have benefited from that. They are not the epicenter. They could have learned, and they now have tools that China did not have the first 30 days of this outbreak. And so that's a different scenario when thinking about how to implement certain public health interventions.
So I think one of the benefits of the Chinese response has been this public security network that goes all the way down to even the village level. And that it gets utilized for many, many different things. One is obviously local security just on a day in, day out basis. But it gets put upon it the whole propaganda apparatus that gets put upon it. And in this case, it was the first structures that were available in order to implement some kind of public health response to this. So you sort of lock down everybody. I mean, I can tell you from our campus, we received directives from the Ministry of Education, from the Jiangsu Education Department, from the Suzhou Education Bureau, from the Kunshan Education Bureau, all at one time, just sort of pouring down in multiple task forces, basically giving us directives about what the campus needed to do. And so the compliance reaction is very, very important. We were, Chancellor Feng and other Chinese senior staff, very, very focused in on compliance with all those directives, because if we didn't comply, even those directives had consequential notices that if you don't do this, you're in hot water, more or less. And so I think that is very important. Our systems, I don't know if they can carry the weight of that, but on the other hand, I agree with you, our public health network is much better. So, and I think that's the essence of Jessica's question. We don't have that public security part of it, and so how do you force people to do things if, in fact, our decision comes locked down? What if the best choice we have at the end of the day is locked down? What would we do? How would we respond? And that raises, really big issues for our society.
So I have a much smaller scale question. Saturday's the beginning of spring break for Duke. That's 6,000 undergrads just going all over and then coming back a week later. And I know that one of my friends is planning on going to Italy, and he feels like coronavirus is not going to stop him. I have plenty of friends from Washington State. People come from all over. So on a much smaller scale, what about Duke? After spring break, I think people have this idea that, I'm not going to catch it. But in reality, we're all traveling to different places. I'm just going home to Ohio, so hopefully that's okay. But a lot of people are going home to places that have cases already of coronavirus. And as we've seen, it's really contagious and it spreads really quickly across borders, and it doesn't matter where you're from, you can still catch it. And like, college is a petri dish. We all touch the same door handles, the same printers, everyone gets crammed together at shooters. And so basically, if one person comes back from spring break, like, my question is, if one person out of 7,000 undergrads comes back a week later infected with the virus, what do we do? Because there's also so many issues with asymptomatic patients and really having a hard time tracking the virus until it's way too late. So
I believe there are plans in place to acknowledge students that are about to go studying abroad, and rules in place for them who are returning. So I think that's.
I'm sure this is on the mind of every senior administrator in every university across the world right now.
But it's especially on the mind of faculty. And so, since you're in my eco-media class, which meets in an hour, just to let you know, after spring break, we will be going entirely online because I'm not going to wait for the directive. Right? We have had no information from the Duke administration about what the plan is going to be and how we should be responding. Only a week. The people return a week from now, right? And there's been no word on this.
Yeah, and there's focus on study abroad, but people are just going to places
study
for
abroad
fun.
to Seattle.
And also, no one, there's no, keeping track of where people are going. There's no one coming back to say, I went to a spot with coronavirus cases.
This is what I meant. We want surveillance now.
Thank you, Ralph Litzinger. Now we know your official view. Ralph Litzinger requires surveillance for the entire campus. Let this be now put down in writing. I'd like to thank everybody for participating. This has been a truly amazing panel. I think this is, if there has been a silver lining in all of this, is that it has brought the two campuses of Duke and Duke Kunshan University together, if only around this tragic event. But nevertheless, I think there's there's an outpouring of sympathy, I think, from the Duke students and from the Duke professors towards Duke Kunshan and towards China. I think it's great that we can all be here and have this panel, and I hope that it's been useful and informative and educational for all of you. This will be put up on the DKU Humanities Research Center website. So that's sites.duke.edu/DKU Humanities. And thank you very much to all our distinguished participants for contributing. To those of you in the audience, we had about 40 people here and about 190 people online. So thank you all for that. And I look forward to having another of these events in a more pleasant situation at some point in the future. Thank you.
Thank you.